Welcome back to Primetime News.
And a special welcome once again to our viewers on TVJ International in the Cayman Islands and online at onespotmedia.com.
And we begin this evening with news from the medical field. For decades, Cuba's overseas medical missions have been one of the country's most visible international programs.
That visibility has gone dark locally. Romardo Lyons has the conclusion of this special report, Discharged, Cuban healthcare workers leave Jamaica.
The Jamaican government has expressed appreciation to the government of Cuba for its long-standing contribution to the country's health sector. But gratitude won't treat patients. Opposition spokesman on health, Dr. Alfred Dawes, said the sector will face challenges.
I'm very worried for the country. It's unfortunate that we are victims of great power rivalry, because that's exactly what it is. And it's unfortunate that we're trading the healthcare of our Jamaicans for diplomatic goodwill.
The close to 300 workers are being offered individual contracts. While Dr. Dawes doubts a high take-up, Michael Stern, chairman of the Southern Regional Health Authority, thinks otherwise.
If you give them a contract tomorrow morning and they are allowed to come back, 100% of them coming back here, because they like the condition under which they work here. They love the Jamaican country as a whole and what it offers, and they are very pleased with the service that they offer to the people of Jamaica.
Many of them would like to come back here, and I'm praying for them to get through with all the documentation, and we will be waiting for them here in Jamaica.
Them knowing that, they're not gonna go back to Jamaica, continue working, continue making a good amount of money, being able to get or provide for themselves and their families. Yeah, that's that being out of the way for them, yeah, it would definitely have them frustrated.
Despite concerns raised, the ministry is urging calm. The officials are saying there's nothing to worry about. On March 9, 2026, Health Minister Dr. Christopher Tufton said negotiations are advanced to conclude a memorandum of understanding agreements with Ghana and Nigeria. He also said Cabinet gave approval for the ministry to do direct recruiting through private recruiters.
We will be pursuing that also to ensure that we shorten the gap between recruitment and getting persons in the system.
There's also a call in the diaspora for specialist posts.
We got 130, just under 140 applications. We have shortlisted those to 70 specialist nurses from the diaspora.
Also, assurances of short-term efforts. Michael Bent is the Regional Director of the Southern Regional Health Authority. He says one remedy is utilizing workers already in the system, offering overtime, extended opening hours, and redeployment from low-burden facilities.
What we try to do is to cauterize whatever the impact may be so it can be minimized as much as possible. Another thing we're also doing is to fast-track the onboarding of staff members, of applicants. So we have been doing some interviews to replace in some of those areas.
How long do you think they will be able to be effective before we start hearing complaints of workers being burned out and stuff along that line?
Right, and we are cognizant of that. So that is why I said that it is a multidisciplinary strategy. So whilst we do the overtime, we seek to onboard new persons so that we can have some replacements and so on.
But this is the concern of workers in the system.
We're already overworked, we're short-staffed, and with all that is happening, people just frustrated.
Dr. Reed Holder is the Regional Technical Director for the authority. In terms of eye care, she argues that the same level of quality will be available.
We do have camps where sometimes we partner with other persons and they come in, and sometimes within a week or so we do all 200 cataract surgery and so on. So there are other programs that are available, and as was mentioned, we still continue to strengthen the eye care program relating to the Cuban, but there are other parishes and other programs because we have ophthalmologists within the system.
She says local workers are qualified for various posts.
Within the Cuban program, we had specialists in different areas. So, for example, would have been mentioned oncology, which is cancer care. Over the years, we would have had issues relating to that and would have brought in persons from Cuba, but over the years we would have also built capacity. So right now we do have a Jamaican who heads the department in terms of oncology, and there are other persons that we're encouraging persons to continue to train up.
International analysts say Cuba's medical diplomacy has begun to unravel. The real question now is how far its ripple effects will spread across Jamaica. Romarda Lyons, TVJ News.
Thanks, Romardo. And staying with this issue because the political commentator Damian Gordon has commented on the situation. He says the timing of the program's discontinuation coincides with what appears to be, quote, an aggressive push by the Trump-led administration to effect regime change in Cuba by stifling its economic lifelines, including the medical cooperation program, end quote. He says Caribbean countries, including Jamaica, are being pressured, whether implicitly or explicitly, to support this broader objective. Mr. Gordon also added that he believes this can cause a widening trust deficit among countries. He says it may also mean that Caribbean states, out of necessity, may be forced to re-examine existing cooperation frameworks with other potentially fragile states that are intended to fill capacity gaps.